Hi everyone. We're going to be starting today the learning how to get rid of pelvic pain and dysfunction, and what we can do about it. Hi there. So we're going to start at 6:30 as usual, and so once you get, I just starting a few minutes and getting everybody on, and hoping that our broadcast is good, so you can tell us if it's good or not. Can you hear us? Can you see us? Can you see us? Can you hear us? Hi there. Okay, so I'm just going to put you, there'll be a few more minutes. Hello. Hey. Hi there. Hey. From Orlando? Great. Hi there. So today we're going to work on pelvic pain and dysfunction, things that we can do for help our patients with, that we can help ourselves with, and our friends, and be able to eliminate all kinds of pain and dysfunction.
Yeah. You're just sitting.
You couldn't believe it.
Yeah, I don't know. I heard something on the news that something's going on between 8th and Roosevelt. I don't know if it's a sewer or what it is, but something is wrong.
Something's wrong?
Yeah, something is wrong in that area. So we were just in a parking lot on Lakeshore Drive all the way here.
Yeah, right. Totally. It's a parking lot. Oh yeah, totally. Yeah, parking lot. You can see my brother Kevin.
Kevin?
Camille.
Hi, Kevin. I've probably met you before.
She's
Somewhere along the line.
Yeah.
I've known her over 30 years. I'm sure I met you somewhere.
Yeah.
So he's here from out of town.
Oh, where do you live? Wrigley Field. That's where I live. I live right by Wrigley Field. Where do you live?
Pittsfield, Massachusetts.
Oh, okay.
7 miles from Tanglewood.
Good. I've never heard of that.
It's like Ravinia Festival.
Okay.
A little bit. Oh yeah, it's not
I've only
familiar
heard
with
of
that.
Boston.
Didn't hear.
Boston. I've
You
heard
never
of
heard of
Boston.
Ravinia?
Yeah, Ravinia.
Yeah. Okay, go
Ravinia.
ahead.
Well, it's kind of like that. They have places like Ravinia in other parts of the
Oh,
country.
okay. Do you want lights on in here?
Tanglewood, yeah, it's kind of on that order a little bit. They had, well, I didn't see, but somebody, last Thursday, Dolly Parton was there.
Oh, I
And
know.
Train will be there later this
Train.
summer.
Everybody
Yeah,
knows
they go back to like the 93 or 2. A fella I know that,
That's after my time.
yeah.
Musically, I
More
ended in
modern,
like
fairly
72.
modern, 90 or the early 90s.
Yeah, I don't know that music.
Although the fellow I know, he knows their format. They're going to have 45 minutes of tribute to Led Zeppelin.
Okay.
Then the last 45 minutes will be their own moderns.
Oh, okay. I'm gonna go get some water. Stephanie's running around like a crazy.
What's the pelvic floor again? There it is.
Periscope broadcast. Periscope broadcast.
I'm gonna be doing most of the videotaping, I take it.
You could do some of it, and you could show Kevin, and he could do some of it, so you could take a little break. Yeah. So yeah, that'd be great.
You work on Stephanie or are you working
Stephanie.
on Kevin?
Stephanie. Yeah.
Okay.
Yeah, and then I might do something with Kevin.
I've got
We'll
little
do
baby
self-care.
stuff, too.
Yeah, we'll do self-care, stuff like that.
Oh, wait, I thought I saw something on your thumb. Oh, here.
I smashed it.
That's from the old injury?
No, I smashed this one.
That was the, that was
Then
the
I
injury.
smashed this one.
This is recent. Okay. That's what you like to wreck your thumb so you can use your elbows more.
Yeah. Yeah. Yeah.
Okay, good.
Yeah, that's it.
They can't hear us talking right now, can they? I mean, we're not on the air.
Yeah, we are.
We are.
Yeah.
Oh.
We are. We're gonna start in a couple minutes. Just start in a couple minutes. Come on board. Hello, everyone. We'll start in a couple minutes. Yes, we can. You can see everything. Great. Thank you for the response. Good. Cool. Cool. You were sick last week? You had to watch the replay on Wednesday? Well, that was good. I'm glad you watched it. Wasn't it great to see how to do to correct those underlying perpetuating factors? Yes, yes it is. Exactly. It is so important. Okay, we're just about to start. Hello, everyone. We're going to get started today on pelvic floor pain and dysfunction. And so I got some great stuff to show you today. Can you tell us about how to get our CEUs? Yes. Okay. I have heard it's you can get the CEUs. Can you explain how to get the CEUs?
Overall, when you're on Periscope, we're able to access who has been able to see the classes. So then overall, we will be sending out a certificate on this.
To the people that ask us.
Yes.
Mm-hmm.
So you can email us at info@myopain.com, or another one would be myopainfree@gmail.com.
And tell us that of your interest in getting continuing education units. That'd be great, right?
Yes.
You watch the shows, and then your our live webinars, and then you can get continuing education units. Now, if you watch all 48, you could get 48 times 2, then, right? Almost 100, yeah. Okay, so that's great. So back to me for a second. So here we are in Chicago, on the top of the water tower, and we're in suite 976W. That's
976W.
yeah, so you can see it's a nice day out there today. It's hot. There's so much traffic, we can't believe it. We don't even understand how we got that much traffic today, right? It was a parking lot.
Yeah.
The whole lakefront, everywhere downtown, it's a parking lot, yeah. All right, so I'm going to turn it over to Camille here. She's going to videotape us here. Thank you. Okay, so turn it around and then you can film me. I think you got it there, right?
We've got it. There's Sharon again. And the mountains behind her.
And the man-made mountains.
That's right. I tell everybody we have mountains in Chicago. They just have elevators in them.
That's
And
it.
Sharon also calls them mountains. So
Yeah, we both agree on this.
yes.
Okay, so I've helped so many people with pelvic floor pain and dysfunction. And the book that was written not too many years ago by a doctor in California called Migraine in the Pelvis. I've gotten many men, particularly, who came in after reading that book and going out to see that doctor in California. And he shows how all these myofascial dysfunction can cause the pelvic pain in his book. But he also has people meditating and doing other great things. But today I'm going to show you the things that I found were so important. So many of these people came to me, and I was able to get them to be full function and pain-free. And
Hey, I've heard that somewhere before. Is that the name of somebody's business?
That's pain-free and full function.
Oh, okay.
But that's the reason I named this business as, because it's so important. It's not just to be pain-free, but you want to all important parts. This part right here. You have to make sure that this part is moving, right?
Right.
It's got to move all the time. So what is some of the biggest causes of pelvic pain and dysfunction? Sitting. Sitting.
Olympic sitting.
Olympic sitting. Olympic sitting. So it is one of the big causes, but there's other causes, and it's a very important to look at the myofascial causes of pain and dysfunction, no matter where it is in the body, and that includes the pelvic. Let's look at a few of the muscles, and let's talk about some of the things that I find, and then I'm going to demonstrate how we treat some of them on some of us here, and also learn how to do some self-care on it as well.
We're getting so many hearts already.
Oh,
wow. And so
thank
when I do
you.
this, that means...
So many men and women, but I have to say a lot of men come in with extremely bad pelvic pain, and they're young men. They're not even old men. And so it's happening to young men and young women, as well as women and men of every age. And so definitely it's a really important area for us to look at and treat and help people with. So let's take a look at the floor. Come on with me. Okay, so I want to introduce some of the people we have here today. So I'm going to turn it around and take a look at you, Camille. So we have Camille right here today.
Hi.
And we have Stephanie right here. And stand up. And we have Kevin, who came in from, where'd you come in from?
Massachusetts.
Okay, he came in from Massachusetts. So he's got a Chicago shirt on. And that's where Camille. That's it. Okay, turn it back to you there. Okay. So let's take a look at the pelvic floor right here. So let's take a look at, come over here, let's look at one of my nice pictures. So see if you can, this one over here. So you can see here's the pelvic floor, and here's the gluteus maximus. We're looking at the bottom of the pelvis. So here's where the sit bones would be, and here's where the pubis is. So many times here you got your ischial ramuses and stuff. So we'll take a look at this whole region. but this is the bottom of the pelvis, and it holds the organs in, and it's a floor for the bottom, and it also affects your urinary ability to urinate and your ability to defecate. So that's pretty important, wouldn't you say?
Very important. Have to do that.
It's very important. Let's take a look at some of the muscles that refer pain to this area. Okay?
Where do you want to go?
Come this way with me. Okay, so we're going to take a look here in my book for a second. Come over here. So we put a big section here. So in this trigger point therapy for low back pain, and this book here, Sharon Sauer and Mary Biacolana. So here, if you take a look here, we read this is our section on the pelvic floor, chapter 15. And where are the pelvic floor muscles and what do they do? Okay, so there's the pelvic floor muscles include a variety of small muscles that together provide a sling or hammock to support the internal digestive abdominal cavity. In addition to providing a floor for the bottom of the trunk, these muscles help to perform bodily functions of. So this was, of course, so important for our if we're going to have children, if we're going to urinate and defecate. So these are all important, and if you can't do that, you're in pretty bad shape. And so important to be able to have sexual activity as well. The principal muscles of the pelvic floor include the levator ani, the sphincter ani, the coccygenius, the profundus, the superficialis, the bulbus, and the ischio-cavernous. So those are, don't worry about, we're not going to be treating those today. We're going to be treating.
You need to know how to pronounce them and spell them, right?
Yeah, right. No,
today?
This particular, we're going to particularly focus more on the muscles that refer pain to the pelvic floor. So these are good to know, and it's good to know how to treat them. But it's particularly good. We're going to be looking at treating the gluteus maximus. So here, take a look. Okay. The gluteus.
Right here.
Okay. Okay, let me do it. Okay, so we're going to be doing the gluteus maximus, the gluteus medius, the gluteus minimus, the hamstrings. We're going to take a look at the piriformis, the multifidus, the iliopsoas, the quadratus lumborum, the rectus abdominis, and the soleus. And those are all in this book. So this book is Trigger Point Therapy for Low Back Pain. So you can order that on Amazon. So we'll show you how to treat and evaluate all those muscles. But in addition to that are the adductor magnus, the adductor brevis, the gracilis, the oblique abdominals, the pectineus, the vastus lateralis. So these are particularly important, and I'd say of those ones that we just mentioned, the adductor magnus and the adductor brevis are particularly important. So let's take a look at some of the referred pains. Let's look at them over there on our referred pain charts. So let's take a look at some important ones. The abdominal obliques, you see how they refer all the way into and down into the pelvic floor, and can also bother the organs and testicles in that region. So that's very important. Also, take a look here, the psoas. The psoas is one of the muscles that refers here into the pelvic region. But in addition to that, the iliacus muscle, which is deep inside the hip here, also refers a lot into the pelvic floor and has a lot of nerves and fascia that would be affected by the pelvic floor. Another area that's very important is the abdominals, and they refer, the rectus abdominis refers right into the abdominal cavity, and a lot of the fascia in there and muscles can cause pain into the pelvic floor as well. So let's take a look at the quadratus lumborum, and you see here that it causes pain in the hip, but also it could be refer into the abdominals, and then could cause some pain into the pelvic floor. Now she calls these the muscles that cause the pain in the tail. So here we've got the obturator internus, and it causes, you can see, it causes kind of a diffuse pain here in the thigh, and it causes pain here in the tailbone region. And also you'll see that the Gluteus maximus causes pain all through this region as well. So it's going to be important to treat that gluteus maximus. And we'll have some ways that you can treat it yourself. Gluteus minimus is very important, and it's going to be important in treating for the pelvic floor, and also the piriformis and all the referred pain patterns for them, but they cause a lot of pain in the pelvic floor. The piriformis here. So those are important. Now let's take a look over here at the hamstrings. Listen to the blue section there. Now this is so common. This is like the most common cause maybe of pelvic floor pain dysfunction right here. So let's take a look at that. Okay. So you'll see. So where does a chair? We call the hamstrings the chair seat victims. You know. Yes. So here's the hamstrings. Look at, if you sit on a chair and the chair presses on these spots where right here, it can activate the pelvic floor. And then if the muscle's short all the time, when you're standing, it can also activates. So you can get this, so the semitendinosus and the semimembranosus cause really bad referred pain into the pelvic floor and can cause a lot of pain just from sitting. Another important muscle would be the gracilis, and I don't see it on here, but we'll look at it in the Travell book. Another one here is particularly important, really important, is the adductor magnus, and it refers up into the pelvic region here. So you can see your adductor magnus muscle. So it refers up. So the part that refers up is high, just in the issue-ramuses. So right there. So it refers to these high ones up here, refer into the pelvic floor and all throughout the pelvic region. So they're extremely important. So our adductors, so we have to make sure our adductors are working. We have to make sure all of our gluteal muscles are working. We have to make sure our hamstrings are working. We've got to make sure the abdominals are working. So those are some of the really important ones to make sure they're working. Another one that we didn't look at here, it's referred pain pattern, is gracilis, and we'll look at that. So let's just take a look at me for a second. You see gracilis anymore? Oh, there it is.
Right here.
Oh, there it is. Okay, well, you don't see a good picture
You don't
of it.
see it, but
Okay, but so the
gracilis,
gracilis, you know, starts right here at the pes anserinus and goes and attaches onto the ischial ramus, and if it's really tight, what happens is the gracilis and attaches here to the pubic bone, to the ischial ramus there, and what happens is it gets so short that it pulls on the pelvic floor, and it can cause your urethra to really burn, and also can cause you to feel like you have a bladder infection.
That's the gracilis?
Yeah, the gracilis. It's not the referred pain, it's the tendinitis of it. It's like it pulls on it. And so that's important. And also all those adductors, they refer up into the pelvic floor. So let's take a look at asking that are causing pain in your pelvic floor. So we could first consider the medical evidence. You could take a look and have all your, you know, you could have your physicians check your gynecologist could check you, your urologist could check you, make sure you don't have any problems. But then once you've made sure that you don't have any of those problems, then you want to take a look at the myofascial causes. Or maybe you could look at the myofascial ones first. You could just decide. Yeah. So what if you had intense burning, vaginal burning? Or what if you had sharp burning sensations during intercourse? Or what if you had deep soreness after intercourse? What if you had intense pain during or after urination? Or a sense of constant needling in your while you're urinating? Occasional incontinence, persistent pain in the lower abdominal area, groin, or inner thighs. So this would be, if you answer any of those questions, it could be myofascial, but it could be a lot, you know, it could be a lot of other things as well, but it could be myofascial in origin. Because of many of these problems fall within the purview of a specialist of physicians, you may be offered all kinds of options, exploratory surgeries, all different kinds of things. But one thing that never happens is they usually aren't looking for the myofascial causes of these pains. So that's what we're going to do. We're going to look at the myofascial causes of these pains and dysfunction on with the organs. So we're going to look at, now in Travell's book, and Travell said to us dysfunction into the muscles, and the muscles can also cause the pain dysfunction in the organs. So you can have quite a bit of dysfunction there. Okay, so we're going to take a look at our adductor. So here, this is one of the most important, and you can see here how it attaches here onto the ischial ramus.
I'm
And
getting a glare.
oh, put it down. Yeah.
Something different.
Oh, there you go.
Still
A
glare.
little glare. Okay.
Yeah.
Okay, so you can't see it. That's too glary.
No, we can see it, but you can't read it.
Okay. All right. So what the most important area is right in the top here. Let's go ahead and here we're going to look at the adductor magnus and also.
You have to angle it
Good.
a little better.
Good.
Out
Okay. So
there.
and we're going to go ahead and take a look at that on Stephanie. So I'd like to just tell you a story about one patient that came in recently that had she had this deep soreness after intercourse and pain after urination and constant needling feeling. She had all these symptoms, and she had been to a pelvic floor specialist. She'd been to a gynecologist. She'd been to all different kinds of doctors, and I'd seen her about let's say 9 months after she had a baby. And what I found was she had significant myofascial dysfunction around all the intestines, and so it was really fascial dysfunction causing most of her problem, you know. But she had everyone check her, and she still 9 months later, and she had a lot of treatment. She had a lot of pelvic floor treatment, but still after all that, she still had the burning. She still had the pain after intercourse, and so forth. And so we treated the abdominal area and found some really significant myofascial dysfunction in the fascia around the organs, around the colon, and the intestines. And we got rid of her pain, I think, in treating her about 3 or 4 times. Didn't take too long.
That's excellent.
That was really good. And another young fella who came to us after reading the book Migraine in the Pelvis. He had been seeing that doctor in California, and he was married, a young guy, but he was a writer. And of course, what do writers do? Do they sit? They sit, right? And he had he wrote magazines, and he was a big time writer. So one of the troubles he had was his profession was sitting, and he ended up getting really bad pain and dysfunction, and even got diagnosed as having fibromyalgia, but it started in the pelvis. And it didn't take us too long we evaluated him, found that he had all kinds of myofascial pain dysfunction. He had every kind of underlying perpetuating factor. We corrected them all. We treated him, worked with him. He was really good at doing his self-care. And his main reason that he wanted to do this is because he wanted to get off. He was on all kinds of pain medications and every kind of drug he was taking for the problems that he was having. And they were even causing him to have liver dysfunction. And so he stopped taking some of them for that reason. But he wanted to get off all the drugs. But why did he want to get off all the drugs? Why do you think? Why did he want to get off all the drugs? He wanted to have a baby.
Oh.
And his wife was in terrific shape, and she wanted to have a baby too, but he didn't want to have a baby on all those drugs, all those prescription drugs, medications, I meant to say.
Yeah.
And so that was his main goal, was to get off all the medications. So we evaluated him, treated him, trained him to treat himself, and finally it didn't take too long, and all his pelvic pain was gone. He was off the drugs, and now guess what? He has a daughter, 2 years old now. Yeah, and I've got numerous stories like that, and many of these people that have had this really bad pelvic pain and dysfunction are now. They have 2-year-olds, or they have 4-year-olds, or they're doing great now. It's satisfying to be able to help people be able to urinate, or I had one fella that when he stood to urinate, he would defecate, and so he had and guess what trouble he had? So someone guess what muscle was his worst muscle? See if anyone knows. See if anyone comes up with it. Okay, so would it be the gluteus max? Would it be piriformis? Okay, it was his adductors. His adductors were.
Advagnus, somebody is.
Yes,
guessing.
that's what it was. Okay.
Okay.
It was. Thank you. Okay, so his adductors were like a rock. Okay, and they had no movement, nothing. They were just completely like a rock. And of course, he had first metatarsal deficits, so I corrected that and treated his adductors. From after one treatment, he never had the trouble again. So it was bang, fixed, just like that. So that was so I have many stories of different muscles causing different kinds of pelvic pain, and how we've corrected it, and what we needed to do. But you have to. He had no ability to shorten the adductors and had no ability to lengthen them. So so you have to get the muscles to have full shortening
Okay,
and
someone
full
said the
lengthening.
connection is dropping. We have been flashing in and out the
Oh,
whole
we did
time.
notice that. We
Yeah, we
noticed that.
noticed that. So
What
I
do you
don't
think?
know what the situation is here.
Oh, they're
The net, it's off the Wi-Fi, so we might have to restart normally.
Restart?
restart.
Normally, that's what Jason.
Okay, well.
Every few minutes, it's dropping a lot. Okay.
Oh.
We got two different people said that. One said every few minutes and one says dropping a lot. But I know we've noticed the flashing.
Yeah, so it
in
is.
and
So,
out
so there's
a
something
lot.
causing that. Okay, so why don't we? So I think what we'll do is we'll restart. So if everyone could just be patient, we'll restart then right now.
Okay.
We'll start it over again.
Okay.
Okay, hang on.